Good afternoon, friends. I'm Dr. Laxman Jessani. I'm a consultant infectious disease specialist at Apollo Hospital, Navi, Mumbai. We are going to talk about COVID-19 and its variants. So, friends, we get usually very frequent questions about what is this Omicron. Everywhere we are hearing about Omicron. What is this Omicron all about? So, friends, Omicron is one of the variant of concern what the WHO has said about coronavirus. So coronavirus can be of various strains. So in the year 2020, when the original coronavirus had started, the coronavirus was called the Wuhan strain. Then we saw in 2021, there was a second wave which was present, and this was because of the Delta variant of the coronavirus. And now in 2022, we are seeing the third variant, the third wave, which is called as Omicron. So Omicron is nothing but one of the variants of COVID-19 infection. The other question is, should we be concerned about Omicron? The answer is partly yes, you should be concerned about Omicron because Omicron is more easily transmissible as compared to the Delta variant. But the good thing is that Omicron causes less severe or mild disease. So it causes less severe mild disease, but it is more easily transmissible. So we should be making sure that we follow proper infection control prevention measures. The question next is basically, is Omicron worse than Delta? Well, the answer is no. Omicron is a much milder variant. It does not cause severe infections. But yes, in almost 1% of the population, Omicron can cause severe disease as well. But in general speaking, Omicron is usually a mild variant. What are the symptoms of Omicron? So the symptoms of Omicron are usually same as that of the coronavirus that we know. So it will be basically a respiratory tract infection. You will have cough, cold, sneezing, running nose. Then if the infection progresses further, you may have cough with expectoration, then there can be breathlessness and so on and so forth. But in general, the infections are pretty mild and there are few symptoms which are very typical of Omicron. For example, headache, throat irritation, cough with minimal expectoration, easy fatigability, lots of body ache, tiredness and of course night sweats. So these few symptoms are quite characteristic of Omicron, which is slightly different from Delta. But overall speaking, mild to moderate illness of Omicron is present and Delta was a more severe disease. The next is, what is the rate of spread of Omicron infection? Well, Omicron has been spreading with quite a rapid rate. As I told you earlier, Omicron is more transmissible, but it is less virulent, that it does not cause a severe disease. But because it is easily transmissible, we see more and more infections of Omicron spreading rapidly. Nowadays, if you ask anyone whom you know, your relative, friends, family, some person or the other is definitely now infected with coronavirus, the Omicron strain. The question arises, how will vaccines be helpful for this coronavirus strain? Well, friends, the studies have shown that vaccines are efficacious against the coronavirus strain as well, may not be as much as it was thought earlier. So that does not mean that we should not take vaccines. Friends, vaccines prevent you from developing severe disease. It does not prevent you from total disease at all. So if you have taken the vaccine, you are sure that you will not get a severe infection once you are infected. And this vaccine prevents you from coronavirus infection of the Omicron strain as well. So friends, do take the vaccine, do take the booster dose for the healthcare workers and the elderly population, because that will help you from developing severe infection of Omicron. What are the precautionary doses? I think the government of India has been very categorical and they have mentioned the precautionary dose which needs to be taken for all the health workers and the frontline workers, and all for the senior citizens, elderly people above the age of 60 and those people who are having multiple comorbidities. Definitely precaution dose will help you prevent the Omicron infection. How do I get diagnosed with Omicron variant? Well, friends, it is actually very difficult to diagnose whether you have Omicron variant or not. The reason being, the Omicron variant has a presence of S gene dropout, but we do not have all the kits available for S gene dropout. So Omicron is picked up in your routine RT-PCR, but it will not categorically say that you have Omicron because not all RT-PCR kits are equipped with S gene dropout. Those RT-PCR kits which have S gene dropout in them, you can definitely say that this is Omicron. But for 100% confirmation, we need to do a genomic testing, which is not practically possible for all samples. So the general consensus and the study which we have done so far tells us that most of the strains in Bombay right now which is going around is Omicron variant. So almost 88 to 90% of the strains are Omicron. So if you are having a COVID virus infection, there are high chances that probably you are having an Omicron infection as compared to Delta or other strains. Does it infect people more who were infected earlier? Well, as I told you, Omicron can escape immunity. So, for people who have got coronavirus earlier, they can again get infected with Omicron as well. But the good thing is the infection will be mild and it will not be very severe. Can Omicron fuel the third wave? Yes, of course, we are already in the pandemic, in the third wave, we are already there, and Omicron is responsible for the third wave, what we are seeing right now. The question I frequently get is, what do we do if we get coronavirus or Omicron positive? Well friends, as I told you earlier, Omicron is a mild disease. So you don't need to be worried about it. You just need to have a symptomatic treatment. Just maybe some nasal decongestion, cough suppressants, multivitamins, that is sufficient. You don't need to have some fancy medicines at all. But you should watch out whether you are developing severe infection or not. So just you have to be more vigilant. Take your symptomatic treatment and be vigilant if you are not improving. When do you seek hospitalization? So friends, if you are developing hypoxia, that is desaturation, that is breathlessness, in those cases are the time when you need to visit a hospital and get admitted, or if you have a very high persistent fever which is not settling down. So desaturation, saturation dropping less than 94%, or a high grade fever, or any complications of Omicron. If any of these are present, that is the time you need to seek hospitalization. But a simple cough and cold if you are having, you don't need to be hospitalized for it. How do we keep ourselves safe? Well friends, the three most important things are, number one, vaccinate yourself. Make sure that you have taken your 2 doses of vaccine totally, and those eligible for the third dose, the booster dose or the precautionary dose, should take the third dose as well. Second thing, wear masks. Mask is the single most important thing which will help in prevention of infection. Avoid going in crowded places, and whenever there is a lot of people around, make sure you wear a proper mask. Many times we see people wearing mask which is covering only the chin or the mouth. The mask should cover adequately your nose and the mouth totally so that you don't get the infection. And the third thing is social distancing and hand wash. So whenever you get an opportunity, make sure that you use hand rub, hand wash after touching surfaces, and you maintain at least 3 feet social distancing from other people. So vaccine, social distancing and mask. These are the 3 most important things which will help us in preventing coronavirus or Omicron infection. Thank you.